Hey guys, welcome back to the Dynamic Mobility Project. Today I want to talk shoulder. This is a common issue I have with a lot of athletes coming into the office. The most common presentations we're seeing right now is people having pain reaching up overhead or whenever they're kind of reaching around behind their back like they're trying to tuck in their shoulders. We're finding a lot of anterior or front shoulder pain or that real deep pinch or ache pain as well deep in that shoulder joint. So today I want to go over 3 basic exercises that we can do. It is a foundation piece so we can start mobilizing that joint, stretching the tissues going into that shoulder, and begin pumping out that inflammation inside that joint. So the very first one is going to be the posterior capsule stretch. Whenever we do this stretch, we're going to take our arm, say our right arm is the shoulder giving us trouble, and we're going to stick it right out in front of us. We're going to bring that across the body and use our opposite arm right behind the elbow. And we're going to pull that close to the body. Now, that will give you a little bit of stretch on the back side, especially if you're experiencing a lot of pain. But the next step I want us to do is, I want us to take that shoulder and drive it back and down against resistance. If I remove my left hand, I should feel like I'm opening my right arm away from my body. So we're going to pin it against our body, pull that shoulder blade back and down, and we're going to hold that stretch for 60 seconds. This is called the posterior capsule stretch. Really good to target the back side of the shoulder right in this region. The next stretch I want to go over is the towel stretch. It's a clever name, but we don't have to limit ourselves just to a towel. I like to use a little heavier TheraBand. You can use a rope, a belt, whatever's at your disposal. Again, sticking with that right shoulder, if this is the problem area, I'm going to take that towel or band over my left shoulder. Now I'm going to want to reach around and grab that band. Whenever I grab that band, you can see I actually have a window right here. We're going to want to close that window. So I'm going to take my hand high on the band, and I'm going to drive it at 45 degrees across so I can pull that arm and close that window. Then I want to pull it up high and lock it in over the shoulder. Another example of this will be, we're going to reach around and we're going to grab that band. We're going to pull it across the body, lock it in high, and then lock it in over the shoulder. The last mechanic we're going to work here is pinch our shoulders back. This is called the towel stretch. We want to hold this for 60 seconds. Once we finish the 60 seconds, we're going to ease out of this stretch. You might feel a little stuck coming out of this. That's okay. We're taking that tissue to the end range. Really good to hit the pec, the biceps coming in, and that anterior deltoid into the capsule. The last exercise for today is going to be the pec stretch. So again, we're going to try and open up this shoulder joint through here. There are a million ways to do the pec stretch. This variation is very easy to do. We can do this on a door frame, on a wall, whatever is comfortable for you. All I'm going to do is stack my arm at a 90-degree angle. I want my elbow to be in line with my shoulder. Same arm, same leg, so right and right. I lunge forward with my right leg and I start opening my shoulders away from the stretch. We're going to hold this 60 seconds. A modification that we can do is put our arm straight out. This will isolate a little more of the bicep and a little less of the pec tie into the shoulder here. Same mechanism, same arm, same leg. We lunge. We're going to twist into that, and we're going to hold 60 seconds. Guys, I hope these 3 exercises are something you can begin to develop a foundation with to mobilize that shoulder and start eliminating some of that pain. If you ever have any questions or feedback, please reach out to us. Until next time, have a good day. Thanks for tuning in.